Thank you very much for joining us today at this ATACH meeting on mental health systems and climate change, hosted by United for Global Mental Health in collaboration with the Climate Care Centre at Imperial College London and the Global Mental Health Action Network. It's fantastic to see so many people joining and interested in this topic, so thank you very much for making the time for being with us today. My name is Alessandro, and I'm going to be your host for today's session. As people continue joining, I will go through a couple of housekeeping items. Firstly, given it's a few of us today, we don't really have time to go into introductions, but please feel free to drop your name and location in the chat. Additionally, interpretation is available in French and Arabic. To activate the interpretation, as shown in the slides, you need to select the interpretation icon at the bottom of your screen and then select the language which you would like to listen in. As always, please, if you're not speaking, we would kindly ask you to keep your microphone muted in order not to disturb our speakers. And in terms of the agenda, so next slide, please. Thanks. The session will last approximately 1.5 hours. We will start with a brief overview of climate change and mental health by Dr. Emma Lawrence, followed by a series of short presentations looking at the impacts of climate change on mental health systems. We will then move to solutions and hear a presentation on how mental health systems could become more sustainable. And after a short break, the second part of the session will continue to focus on solutions on how to make mental health systems more climate resilient. We will then conclude with some closing remarks by Dr. Mark van Ommeren, head of the mental health unit at the World Health Organization. If during the webinar you have any questions for our speakers, please feel free to drop these in the chat, which will be monitored by our speakers, or we will have a couple of minutes after each segment for a live Q&A session. The meeting is being recorded and the recording will be shared with you after the session. In addition, to ensure that you have a way of sharing your thoughts on the topic, we have set up a lucid board where we are asking people to add their thoughts to the question on how can we ensure mental health systems remain resilient and sustainable in the face of climate change. The content will feed into a one-pager summary with some recommendations on climate resilient and sustainable mental health systems as an output of the webinar. The link to the Lucid board will be shared in the chat, and also the board will remain open for a couple of days after the meeting. So feel free to add any thoughts that you might have after as you reflect on the webinar. I will now pass it over to my dear colleague, Dr. Emma Lawrence, who will provide us with a brief background introduction on climate change and mental health. Emma, over to you.
Thank you so much, Ale. Can everyone share? Great. I hope you all can see. I'll just get a thumbs up that that's all clear. Great. Okay, so this is going to be a very rapid fire introduction to the interconnections between climate change and mental health. I know all of you joining will have some knowledge of this topic, but we wanted to give a brief overview. So what does it mean to experience the impacts of a changing climate, and what is that toll on psychological health and well-being? It can look like farmers who sadly experience suicidal ideation as another crop fails and they can't provide for their families. It can look like someone living with schizophrenia who sadly passes away due to the increased stress of a heat wave on their already vulnerable temperature regulation systems. It can look like a young person who is not getting access to their education, to a stable source of food and water for their developing nervous systems. And it can look like many, many other things for people around the world. But all of these challenges can lead to a compounding of the risks of poor mental health outcomes. We can see this as a continuum where directly experiencing higher temperatures or extreme weather and climate events can increase the risk that people develop things like post-traumatic stress disorder, anxiety, depression, substance misuse, or sadly dying by suicide, or being at higher risk of physical health impacts arising from living with a mental health condition. But there's also a whole flow-on effect from these climate hazards. And without the right adaptation and resilience, we can see crop and livestock damage, forced migration, loss of habitats, changes to livelihoods, community breakdown, disruptions to health systems, and many, many other disruptions to the conditions we need to flourish and thrive. People are also witnessing these changes either through the news or seeing them in their own lives and landscapes. And this is also understandably distressing and interacting with these other experiences. It can lead to a range of mental health outcomes. This could be, sadly, more cases of deaths by suicide, new cases of mental illness or increased symptoms for people living with those conditions. Sadly, an increased susceptibility to physical ill health or death for people living with mental health conditions, and worsened population mental health and well-being. And mental health and well-being is experienced and expressed and contextualized in many different ways around the world for different cultures experiencing the changing climate. This costs, so it's been estimated that the cost per year of the additional mental health burden due to a changing climate, air pollution, and lack of sufficient green space would be nearly 50 US billion per year by 2030, accelerating to over 500 US billion per year by 2050. The challenges that I just described for that the climate poses to mental health also don't happen in isolation. And what we hear from communities around the world is that while they may have always experienced climate risks and hazards, that under a changing climate, they're getting more frequent and severe, which is compounding these risks and stresses, and they're no longer able to recover so much before the next impact arrives. And these extreme events interact with disruptions for the conditions that we need in our sort of stable societies for good mental health and well-being and access to a clean and healthy environment, and also interact with our psychological and emotional responses to being aware of the climate crisis and what that might mean for us now, but also in the future. But there is an opportunity at the heart of this when we recognize that the health of our minds is intricately linked to the health of our environments. We see that by protecting the conditions for good mental health, those things are often creating the conditions for a healthier environment, and vice versa. When we protect the environment and the climate, whether it's through greening our cities, making active transport more available, strengthening our community connections, access to community-based healthcare, and strengthening our health systems, there is an opportunity to do this in a way that leads to both people and planet flourishing together. And we're here today to showcase that vision and some of the case studies where this is already happening around the world. Thank you very much.
Thank you very much, Emma, for this, and I hope this helps orientate people to the rest of the session. We will now open our first segment of the webinar with a short panel of two speakers, which will outline the different impacts that climate change is having on their mental health systems in two different countries, Sri Lanka and Mozambique. I'm really delighted to introduce to you Ananda Galapati, co-director of MHPSS.net and Director of Strategy for the Good Practice Group from Sri Lanka, and Dr. Palmira Fortunato dos Santos, Coordinator of the Mental Health Trauma and Violence Program at the National Institute of Health in Mozambique. Ananda, the floor is yours.
Thank you very much, Ale. And good morning, good afternoon to all of you. I'd just like to share a couple of brief reflections from the experience of Sri Lanka. As many of you will know, Sri Lanka has had the experience of multiple major crises over the past 4 decades, including a 30-year civil war, 2 separate armed insurrections, the 2004 Indian Ocean tsunami, and more recently, some extremist attacks in 2019, COVID-19 that we all experienced, and an acute economic crisis in 2022. And in many ways, these crises have really driven the development of mental health and psychosocial support services in the country, both in terms of emergency response, as well as strengthening the mainstream mental health and social care systems. But even as this sort of considerable relevant experience and capacity was developed to respond to one crisis, and that was then utilized in response to the next one, there seem to remain some challenges as we anticipate the needs in relation to increasing climate-related impacts on mental health in Sri Lanka. So one key insight from the past decade or so of crisis response in Sri Lanka is that the system-wide capacity for MHPSS crisis response is not necessarily sustained over the longer term. So psychiatrists, nurses, public health administrators, community social workers, and even community leaders often over time change roles, they retire, and even if they remain in post, they may lose unused skills. And the mental health workforce have also been impacted by the toll of responding professionally to consecutive crises, some of which even affect them personally. And so there's a need to invest in new training, kind of reinventing or recasting policy and program level responses, and inevitably, sadly, also to relearn some of the old lessons that we once knew. The other insight that I'd like to focus on is that responding to climate change requires a new set of approaches and relationships that differ from what we had developed for earlier crisis response. So delivering MHPSS, so mental health and psychosocial support, in the context of conflict-related emergencies or major disasters like the tsunami or public health emergencies and economic crisis often involves cooperation with a different set of actors and sectors than the integration of mental health support into climate adaptation and response to climate hazards would require. And the skills and approaches required for intervention also require adaptation. So for example, last year, colleagues of mine working in an especially vulnerable district of Sri Lanka, Ratnapura, for those who you might know, met some women villagers who described how their houses had flooded 13 times in the previous year. And they shared how the process of cleaning their houses and restarting their lives, only to have this undone by the next flood, and then going through this process again and again, placed this inordinate physical, social, and psychological burden on them. And it was really clear when we were working there that the existing support systems did not yet have the methods or tools or relationships for engagement to address the needs of these women. And that requiring this meant that MHPSS personnel needed to work with counterparts to figure out how to integrate prevention and response strategies into flood mitigation, local administrative processes that they didn't know much about. So we're very early in the process of MHPSS practitioners connecting with and learning from and working together with ministries of environment and other sectors that are much further along than MHPSS practitioners in the process of engaging with climate-related change issues and adaptation. So those are just two of the kind of system-level challenges, I think, that we face in Sri Lanka, despite having a long history of working on other crises. I'm going to stop there and maybe hand over to Palmyra.
Thank you, Ananda. It's funny to hear that the situation in Sri Lanka is pretty much similar to what happens to Mozambique. We are a country with over 34 million population, and when it comes for mental health system, we have a scarcity of almost everything. In terms of human resources, for instance, we have less than 25 psychiatrists for all this population. It's let's say nothing. We could say it's 1.2 or 3 per 100,000 population. So the coverage itself is not enough. And when it comes for health facilities, we have at this point about 13% coverage in terms of health facilities that provide mental health services. Since 1959 or something, we have records from our National Institute for Climate Meteorology. And since then, we have been facing cyclones, floods, and droughts. Mainly, these are the ones who are mostly reported, and extreme heat as well. And for those situations, the health system sometimes is called to play a role due to impact to the health of the population. Related to floods, for instance, it is very cyclic. Let's say every 2 or 3 years we have extreme floods in the south region, which is very complicated to manage because, as Ananda said, that population keeps returning to unsafe places, and again we have to put in place recovery plans to ensure their safety. But nowadays, our main issue are the cyclones. They have been present throughout the years, but recently the frequency of cyclones is higher. And we realized with that our system is not ready. Our mental health system is not ready. For instance, we barely have people trained in mental health, psychosocial support, and we have been trusting on international organizations, NGOs to give us support in those situations for the emergency response. And our challenge at this moment is to improve the system resilience to do that. What we have as impact in general is that every time a cyclone comes, our health infrastructures are damaged, and mental health infrastructures as well. And one of the main cyclones died in the center of the province. One of our psychiatric wards that is referenced for the entire central region of the country was severely damaged. And as you can imagine, we had a lot of patients admitted there, and it was very challenging to reallocate those patients, provide continuous treatment, because we also had lack of medication. A lot of the medicines went away with the water, with the wind, and we had no medication for a prompt response to those patients. So even if we could put the patients in another setting, the entire service was compromised. The human health resources was impacted themselves as well. So we had to bring colleagues from other provinces to provide this support. And fortunately, we also have international support to that situation. And the learning with that is that we need to prepare ourselves better to those situations. We don't have enough people trained to provide support. From the learning, we realized that we need to have an emergency plan to provide medication immediately, because that was one of the main issues. Because if most of those patients admitted was chronic patients, 1 week without medication is a crime, let's say. And we are now working on that. We are doing a study, implementation study, to ensure that we will be able to advise the Ministry of Health to provide early intervention and have preparedness of the health system for further situations. And I guess my time is up. Thank you, Alexander.
Thank you very much, Ananda and Palmira, for, I think, really laying the ground for our discussion and highlighting the very diverse range of impacts that climate change is having on mental health systems across the world, from disruptions in mental health, community health care, to issues in accessing psychotropics. While we have just seen how climate change is negatively impacting mental health systems, we do have solutions. And in the second segment of the webinar, we will hear from another incredible lineup of speakers on how we can ensure that mental health systems are both sustainable and climate resilient. We will start with a presentation from Dr. Laura Louise Arundel, senior researcher at the Royal College of Psychiatrists, who will present some findings from a recent report outlining recommendations for how mental health services can be made more sustainable and in line with net zero goals. Dr. Laura Louise, over to you.
Thank you, Alessandro. I'm just going to share my screen because I do have a few slides to share. So okay. Hopefully that is sharing for you all and you're able to see the introductory slide. Can I see any nods? Yeah,
Yes.
okay, great. Brilliant, thank you. So I'm going to talk today about a piece of work that we at the National Collaborating Centre for Mental Health in the UK undertook sort of 2023, 2024. So this was on delivering greener, more sustainable and net zero mental health care. We were commissioned actually by a body called Greener NHS, which is a branch of the National Health Service in the UK that's focused on supporting mental health systems generally, not just mental health systems, to reach net zero, become more sustainable and reduce the carbon footprint. So the National Collaborating Centre for Mental Health, which is where I work, is actually an organisation focused on the development of policy, mental health policy. So we undertake academic and policy research, and we also have a quality improvement branch as well. And our focus, essentially our ethos, is on developing mental health guidance recommendations backed by evidence. So for this work, I'm going to talk through the guidance and the recommendations that we developed with a focus on aiming to help services to meet their carbon reduction targets and to be more sustainable. Mental health services are notoriously incredibly carbon intensive and resource intensive. And there is a real strive here for trying to address that, whilst also making sure that care is kept at the highest level of quality, so without sort of compromising the quality of care and how people can access mental health care. So in terms of responding to the question, how can we make mental health services more sustainable and reduce our carbon footprint, whilst making sure we sort of maintain the quality of care and don't introduce any inequalities is a really important factor in access to services for at-risk and underserved groups by way of that. So I'll just talk very quickly through the research that we did. Let's get these up on the screen. So we undertook a series of research methods to develop guidance and key recommendations for sustainable and net zero mental health care practices. We mapped our research findings to the 4 principles of low carbon care, which come from Greener NHS, which you can see on the screen here. So those are keeping people healthy, right care, right place, right time, low carbon treatments and care settings, and the focus on clinical leadership systems and workforce. So all of these areas sort of encompass what needs to happen to ensure that mental health services, and I suppose you could expand it to general health services, but our focus is on mental health today. You would need to be able to achieve a net zero mental health system, or a system that is more sustainable. So our research methods for this included a large literature review where we looked at existing interventions, approaches and initiatives that have been used towards achieving towards the fight to achieve net zero mental health services. We also did a call for evidence where we asked NHS trusts for examples of interventions and approaches already in use, so we could pull best practice. And this included things like looking for existing tools that NHS trusts might be using in their net zero strategies, things like sustainable procurement practices, anything that they were doing already that was showing evidence of some success that could be shared elsewhere, I guess positive practice examples. We also did a review of all of the NHS green plans that are available from mental health trusts in England. So green plans are what the National Health Services here or the trusts will pull together, outlining essentially their methods and strategies for achieving carbon reduction in their service delivery. And we identified and extracted the novel and interesting initiatives there again for more positive practice examples, because an important thing about this work was not just making a list of recommendations, but also providing resources and actionable in practice steps that that systems can take forward. We also conducted a carbon mapping workshop, which was a workshop with a range of expert experiences, lived experience and professional experts, where we mapped the areas of mental health care considered to be carbon intensive and mapped solutions to those as well based on the evidence and expert opinion. So it was a huge body of work, of which I've just provided a sort of really quick overview of, but I'm going to provide the links at the end of the presentation to where the full report and the evidence and resources can be accessed for more information. So I just wanted to talk quickly through sort of the recommendation sort of element, which was the main sort of deliverable output from this work. Sort of the summary of all the research that we did culminated in the development of these recommendations. So the recommendations are categorized under 10 overarching principles, or overarching areas, I should say, aimed at policymakers, professional bodies, system leads, service leads, and also staff and professionals and clinicians on the ground. So here I'm going to talk more about sort of the policy, professional bodies and system and service levels, but we also did pull recommendations that could be implemented by staff, clinicians in their everyday practice as well. So many of the recommendations, a lot of them were focused at that organizational system level, but we did also focus on staff. And it's worth mentioning as well that obviously the ability for staff and service workers to be able to take action on sustainability and carbon reduction was often dependent on those systems enabling them to do so, and those organizations enabling them and empowering them to do so. So just to talk through these areas very quickly. So we developed 10 overarching recommendation areas, and each included sort of essential actions underpinning these. So sort of the big picture changes that we need to see, including things like addressing the social determinants of health and prevention, tackling health inequalities, increasing mental health awareness, these kind of things that are the more sort of prevention elements. Sort of that was in line with the principle of keeping people healthy, for example, less service use, as if you can put it that, as well as things like designing care pathways that consider the environmental impact. So things like care closer to home, collaborative interagency working with, really focus on the structure of systems to enable services to be more sustainable. So on the screen here, you can see recommendation areas 1 to 5. I won't read through them all because in the interest of time, but I've pulled out some example recommendations that are aimed at policymakers, system leads and service leads. And it's worth saying that even where the recommendations might have seemed particularly challenging to implement in practice, where evidence supported their use, they were developed and included. So even where it was like this would be really challenging to implement, if there was evidence for their ability to achieve the goal, they were included. So here, for example, you've got an overarching recommendation area focused on circular economy approaches to mental health procurement. For example, use of the NHS supplier roadmap. And this obviously developed into a recommendation you can see on the screen, which says, so recommending people use a green procurement system. So I'd say sustainability is a factor on the scoring system when choosing which supply companies to use. For example, apply the net zero supplier roadmap, which is an existing tool, to ensure that net zero and social value are embedded into procurement activities. And obviously this is targeted at system leads and service leads to be able to implement that. So all of the recommendations sort of follow this kind of structure where there's how they can be achieved, and who would be responsible for implementing them, along with then tools that can help that to be actually implemented. You've got another one there at the bottom under the recommendation area of enabling the adoption of net zero, sustainable and efficient travel practices within mental health care. Because one of the areas that came up in the research was the amount of carbon emissions from transport used in the mental health system. So things such as recommending transport for staff and patients to travel between hospitals and health service sites to reduce the carbon emissions was another recommendation that, again, it's quite challenging in practice, but with evidence of it being done, with case studies of it being done, with a degree of success. So here are areas 6 to 10, which, because again, I won't run through them all, but I've just put a few example recommendations on the screen here. Something here, we've got improve the efficiency and quality of patient care through sustainability, leveraging existing tools and methodologies. So here we've referenced a tool called SUSQI, or Sustainable QI, which is one of the methods that can be implemented to sort of achieve efficiency and quality of care. We know that particularly in the UK, we have a long-standing issue of inefficient services, or where care is not at the standard it could be to prevent readmission, for example, or the revolving door into mental health care services. So improving quality of care also speaks to this wider the wider goal of making mental health systems more sustainable. So, for example, recommendation there, establish methods of care delivery that avoid unnecessary access into resource-intensive services. And again, alongside all these recommendations, there are case study examples of where services have already implemented these kind of strategies, so that there is tangible case examples to pull from. I think I'm getting close to my time, so I will probably just move swiftly on. I just wanted to make a point as well about saying, even though I've listed here recommendations that are particularly focused at sort of the higher organizational and system structural levels, there are considerable amount of recommendations that are also implementable for, workers in services to do at the ground level. And there were some really good examples of, very motivated and dedicated members of staff undertaking sustainability and net zero actions in their everyday practice within their teams, within even the smaller services under these sort of big trusts. And so there's a recommendation there at the bottom, which is about sort of building net zero and sustainability principles into staff roles and responsibilities at all stages of the employee life cycle. For example, ensuring that is embedded in sort of recruitment, training and progression, so that, it can encourage, the staff and workers to be able to work towards reducing carbon emissions and sustainable practice. So I've just listed here some of the resources. So you can visit our website at the Royal College of Psychiatrists to access the Knowledge Hub, which was the online community that we pulled together in collaboration with the College Centre for Quality Improvement, or the CCQI, which is aimed at that sort of practical element that I've been talking about. So supporting mental health providers to actually engage in these practices, supporting sharing of resources, events, training, and good practice suggestions. There is a webinar series as well that basically goes through all of the work in the guidance and recommendations, and that's available via the Knowledge Hub on our website. And you can view both of the full documents, the guidance document with the recommendations, and also the evidence review and resources as a separate document, which outlines all of the methods that we undertook. So the literature review that we did, the call for evidence, all of the various pieces of work that we did in detail, as well as all of our references and the people involved in the work that we did, in case you're interested in looking at our methodology and how the recommendations were actually developed in practice. It's all there and available. I think that's me. I will just stop sharing the screen.
Fantastic. Thank you so much, Laura Louise, for really outlining, I think, what everybody and everyone working in mental health systems can do to make mental health systems more sustainable, whether you're a policymaker or a clinician working on the ground. And also thank you to all the previous speakers of this segment. We now have some dedicated space for Emma, Ananda, Palmira, and Laura Louise to answer any questions that you may have. I see that we have some questions in the chat, so we'll probably start by reading some of these out and directing them to specific speakers. But also, I would like to encourage people to, if they want, raise their virtual hands and unmute themselves to ask any questions that you might also have for the speakers. But to start with, I think there might be a question maybe for Ananda and Palmira from YIKI, from the World Health Organization. And the question is, from the country implementer's perspective, what are the differences between addressing climate-related mental health impacts versus, for instance, addressing disaster or conflict-related mental health impacts? What additional skills are needed from practitioners? So I don't know whether Ananda, Palmira, or Emma, you might have thoughts on this.
Palmira? Maybe I'll just do a quick one and then hand it over to you, Palmira. So thanks so much for that question. I think it's a really good one. So obviously, first of all, there are lots of transferable skills and approaches. That's a good thing in that there's a lot that we can draw from. However, I think one of the key things is around understanding the nature of climate related impacts, that the sources of stress, that the nature of the impacts often comes from new sources. For example, understanding the impact of heat. It's not something that, mental health practitioners have necessarily been thinking about. And, myself included, we're all trying to get our heads around how does this impact in ways that are less acute, perhaps, than some of the more visible and tangible social types of impacts that we see in other types of crises. But I think the key element, and I'm going back to a conversation I had recently with Mike Wessels, who was one of the pioneers of the field of MHPSS, and Mike was saying that as far as he's concerned, the real kind of profound difference in responding to climate-related issues is that they're fundamentally responded to at a local level. Of course, they're global, but some of the responses for communities are localized, and will necessarily involve local communities and other stakeholders in kind of action to respond in ways that address, from determinants to other kind of mediators and kind of responses. So the skills required are going to be much more focused on the ability to work with local communities and stakeholders, but other actors as well, to integrate elements of mental health kind of goals and outcomes and techniques and skill and interventions into the work that is done together. So I'd say that's a key element that perhaps has been less emphasized in some of the work that we've been doing. We do see in general mainstream mental health a push towards more community engagement, and I think in this context as well we'll see that. Over to you, Palmira.
Thank you, and I would say that the causes are really different, conflicts and climate changes or emergencies. But the thing is that the distress, the psychological impact ends up being similar. So in terms of interventions that our mental health providers need to provide are pretty similar. We need to be careful, of course, in preparing appropriate plans for each situation. In my country, we have both situations. We have armed conflict in the north of the country. We cannot call it terrorism because it's not official that it is terrorism, but we have a lot of internal displaced people with a lot of psychological distress. And as far as I know, the mental health providers who are there providing care for for that population are using a lot of MHPSS tools and interventions to attend that population. I know that most of the cases, the mental health providers are using their clinical skills to attend, but considering the large number of people in those resettlement camps, they have to use those tools. And again, they need to be trained because they are changing all the times because of the burden, of course, and there's a lot to be done. But in the long term, of course, we need to make sure that our staff, our providers, are capable to deal with all these distressing situation that messes with the regular life being of the population. Thank you.
I see you have unmuted yourself. I don't know whether you wanted to.
Do we have time? I know there's other questions. Yeah, just very quickly. I mean, it's a brilliant question, and what we've heard in initiatives like Connecting Climate Minds from people around the world is that, you know, climate change doesn't exist in its own bubble, right? It's interacting and compounding these other experiences. So, you know, when there is food insecurity, for instance, that might heighten the risk of conflict. We see even with the atrocities that are happening in Gaza that's increasing, you know, producing a huge amount of emissions as well as enormous human suffering. So the challenges that we face are deeply interconnected, and we hear for communities sit within contexts of colonialization, historical trauma, current traumas, as well as then the ongoing stresses and challenges that might come with a changing climate. And so within the context of mental health care, what in my experience I've seen, and I'm not a clinician, but as a researcher, seems to be really important, is about how do you strengthen communities as well as the mental health of the healthcare workers and the practitioners in those communities, how we, as Ananda said, enabling the communities to be as strong as possible and with the right skills to be supporting each other through these challenges, and that the strength of those communities and the strength of community mental health care, which can really benefit from all the skills of the practitioners in this room and elsewhere, seems to be one of the key things that can make the difference when we talk to people around the world. And that seems to be what we need for mental health care in general to meet people's needs, and will become increasingly important when there are these escalating kind of disasters. So that resilience piece in terms of people's resilience as well as infrastructural resilience is really important.
Wonderful. Thanks, Ananda, Emma, and Palmira. I think there's a couple of questions, maybe for Laura Louise. So I see two questions. One is about how can we ensure that the carbon and water footprint of artificial intelligence in mental health care is counted when working towards sustainable healthcare. I'm not sure whether that was something that was covered in the report, but yeah, curious to know whether you have any thoughts on that. And then a second question is, again, from Yiki, on whether there's any studies showing that mental health services at lower levels, such as ambulatory care, use less emissions resources than inpatient treatment. So yeah, Laura Louise, I don't know whether you have any thoughts on this.
Thank you. So I think the first thing I'll say is I think that if we were to do for example, the literature review that we did now versus when we ran our searches, I think 2023, around early 2023, I think that we would probably encounter some more sort of up-to-date literature, given how much the discussion around artificial intelligence has exploded in really recent years. We didn't really find much, if I'm honest, in the discussion on the use of AI in healthcare. Obviously, we know quite a lot about how carbon intensive it can be, the use of artificial intelligence. So one thing that we did find, and that is discussed in the evidence review and in relation to the recommendations, is the use of sort of digital methods for mental health care delivery. It's often it seems to be often rolled out as a solution to things such as travel issues between mental health services, or issues that relate to where mental health care particularly in the UK, it's concentrated in sort of cities. It's easier to access for people in urban versus rural areas. So often digital solutions are sort of put out there as the way to manage this. And something that we have to consider when we're thinking about implementing digital methods for mental health care, whether that's through the use of AI or other methods that are already in use, is the carbon impact of that, and whether, weighing that up, if that's actually helping us to reach net zero or it's not. So what's the sort of the balance between providing care online or remotely and providing care sort of in person, where you've got sort of emissions related to things like travel and distance. Aligned with that, part of the work that we did also focused heavily on considering the potential for the introduction of mental health of inequalities that could result as that could happen as a result of implementing particular recommendations. So suggesting that services should move their care online or should move more towards digital methods of diagnosis, treatment, care management, comes with the I guess the potential for people falling through the net. It can potentially introduce inequalities in access to care, which is something that we see already here in the UK, affecting particular groups of people. So when we're thinking about things like digital poverty, people's lack of access to stable internet systems, people's lack of ability to, afford the software, the hardware in which to engage with that, access to smartphones, access to laptops. And then you have the things sort of like digital education, and people who may struggle to utilize technology, in the way in which it needs to be used, if you were moving towards a digital sort of model of service provision. So we talked about some of those things, and part of what we did with our recommendations as well was when we did pull out those recommendations around digital healthcare, and along with all of our recommendations, were scrutinized by what we call our Equality Advisory Group. So if you were to read our guidance and recommendations document, you'll see equality impact assessments were aligned to each of our recommendations done. So you have to consider the practicalities of, of people being able to access digital health. You have to consider the practicalities of people being able to use online services. And I think if we were doing that today, we would also think about, what is the potential downside to artificial intelligence in terms of actually the carbon output that it uses. Sorry, I'm not able to speak too much on the sort of specifics around AI, but it's because it wasn't something that really came up much in our review. But I think it's one of those areas that I would put in the essential future research around net zero. I'm sure it's probably being undertaken already. But yeah, hopefully that slightly answers that question.
Thanks so much, Laura Louise. I think we have maybe time for one last very brief questions. I see in the chat that Emma has asked, when healthcare workers tell us that they are already overwhelmed and climate impacts and action requirements could add to this burden, how are you enabling leaders and staff to learn about this, to have the time to consider and embed this in their work, and to support their own mental health under increasing demands? Ananda, I wonder whether this one is one for you, and after that, I think we can then move to our break. But yeah, Ananda.
Thanks for this, Ali. Thank you for the question. This is, I think, a critical one. It comes up in almost all aspects of the work that we do, because obviously mental health workers and especially in crisis contexts encounter suffering and difficult issues that that are often very difficult to address. There's also lots of workplace issues that are sources of great stress just around the systems that demand a lot of them and sometimes don't don't care for them adequately. And then, of course, they themselves have their personal lives and regular issues, and then the broader contexts of sometimes fragile environments of security, etc. Add to this. So I think in our context, every time we do any type of training or capacity building, the moment you open up the questions around self-care or impacts on the self, it's like opening up a kind of a can of worms. People have a huge need to talk about these and work on them. And I think one of the ways in which we've tried to address this is by setting aside adequate time. It's often not the last thing that we do in a training. It's often sometimes things we do on the very first day, and try and make this an ongoing theme, because it's something that is integral to people being able to perform their functions. I think building capacity at the individual level to understand and manage well-being challenges to well-being and strategies for dealing with it are important, but even more so is also working with managers and people who have often a large impact on the culture and kind of conditions of work. And that, to be honest, is sometimes much harder, because some of the institutions that respond to need often have cultures that do set aside, despite the rhetoric, when it comes down to it, set aside the needs of carers for the needs of clients. And so I think this is something that we need to do, but always trying to find a way to frame this in a way that isn't an either or, but rather recognizing that sustainable services and quality services require that we take care of the main instrument that we have, which is people.
Thanks so much, Ananda, and thanks so much again, everybody, for your questions and to the speakers. So we're going to have a couple of minutes pause, probably 5 minutes. So I think if I could ask people to return at kind of 9:56, 9:57, and we can start with our final segment of the webinar. I also wanted to remind people about the Lucid board, where you can add any thoughts that you might have on how to make mental health systems more resilient and more sustainable in the face of climate change. So as we mentioned in the beginning, the content will then inform a summary document coming out as an output of this webinar. So yeah, thank you very much all again for your participation, and see you in a couple of minutes. Welcome back, everyone. Thank you very much for joining this ATACH webinar on mental health systems and climate change, hosted by United for Global Mental Health in collaboration with the Climate Care Centre at Imperial College London and the Global Mental Health Action Network. So in this last 30 minutes, we will continue to focus on solutions, and in particular, we will look at innovative ways of making mental health systems more climate resilient. We have a great panel of speakers that will outline different possible solutions which are being implemented in Bangladesh, India, and the broader WHO European region. We were supposed to be joined by another speaker from Ethiopia, Dr. Medin Salamo, but unfortunately she could not make it today. But hopefully we'll still be able to feed into the one-pager summary. So we're joined by Mita Rani Roy Chowdhury, Regional Mental Health Advisor for Asia for CBM Global, joining from Bangladesh. Dr. Jaya Kumar, Professor at the National Institute of Mental Health and Neuroscience in India, and Dr. Mareike Kroll, Technical Officer at the WHO European Office, joining from Germany. Mita, the floor is yours.
Thank you. So I am Mita, as I'll introduce. So I have a presentation that I would like to share. Okay. May I check whether you can see the presentation?
Yes.
Okay. Thank you. Okay. So at the beginning, I would like to share a bit about Bangladesh context. So yeah, so it's a country in South Asia, and it's 9th most populous country in the world. So, and Bangladesh has also a largest refugee camp, and the climate is tropical, and there are significant, we have seen significant increase in temperature in last 44 years. And there are issues with national calamities like floods, tropical cyclones, tornadoes, tidal bores, river erosion, landslides, and drought. One of the major concerns is sea level rise and salinity and water crisis, mainly in the coastal belt. And there are waters everywhere, but people cannot access it because of salinity. Okay, so now about mental health systems and health systems. So in Bangladesh, mental health strategy and act are present, and then Bangladesh ratified UN CRPD to protect the rights, human rights of people with psychosocial disabilities. And this is one of the WHO special initiative country because there are lots of things going on mental health supported by WHO. However, the healthcare facilities are considered less than adequate. And of course, most of the services are centered in the capital. And also the professionals, they are mostly at capital level. And there are no mental health services at primary healthcare centers. There are divisional hospitals, there are psychiatry units, but it's mainly based on, I mean, there are no psychological supports in these places, and there is one mental health institution, but again, people are living there for long who has severe mental health conditions. There are National Trauma Counseling Center and Child Development Center, but it's even under projects, so actually it's not a regular kind of services. So we can see that the strategy and act are there, but the services are really limited. Okay, so the concept of climate resilient health system, it's present, but actually there are a long way to go because the initiatives still very less. There are a national adaptation plan and national health adaptation plans. They acknowledge that mental health is important, but again, you can see that the budget for mental health, it's really low. I mean, it's even less than 1% of the annual health budget. So that is why there are not much initiatives by government to address mental health. Though we know that Bangladesh is one of the countries affected by climate change, but when it comes to priority to mental health, so it's in between of competitive priorities. So they consider whether they'll be addressing other health issues or mental health. And again, this access to the mental health services what are available, this is also affected due to changes in weather and disasters. And the gap in data, this is one of the problems to advocate and to show evidences also why we need it. So how we're addressing it. So this is my last slide. So yes, there are mental health services, but there are different organizations, NGOs and civil societies, other organizations. They are working on mental health. So they try to bring mental health at community level. So they're providing training to image gap training for health professionals, capacity building of community stakeholders, school teachers, disaster management committees, so that they can provide basic psychosocial support and they can do the referral. Then various online and private support systems are available, but it's really limited compared to the number, the densely populated county we have. So to ensure right-based mental health services in Bangladesh, there are provision for quality, WHO quality training, and there are work around peer support mechanisms. So who has mental health conditions or lived experience, who are from lived experience people. So they gather and then they are trained on mental health so that they can support each other. An advocacy initiative is also going on to, to work on mental health in this NAP and also National Health Adaptation Plan and to increase budget allocation. So that's all from my side. And this picture is to show that we have a community clinic, small community clinic at community level, at village level, and it has some gardens. So that is why I use this photo here. Thank you. Over to you. Hello.
Thanks so much, Mita, and really love this picture. Thanks for sharing that with us. Dr. Jai, over to you.
Hi, a very good afternoon to you from India. There it is 9. I think here it is actually 1:30 lunchtime. So with this lunchtime, actually, to meet you all there. And coming from an Indian perspective, you all know actually that this is a most populous country in the world. By 2025, it is 1.46 billion population. It's a huge country of varied weather conditions, from tropical to desert to an Himalayan this side. So we have actually every type of disasters in our plate. And so coming to the vulnerability aspects, India is one of the top 5 countries in the world. Presently, we are handling 3 disasters. One is in Delhi floods, and another one is in Bangalore floods. And these are all urban floods actually keeps happening there. And the Mumbai one, and more actually in the coming days we are expected. And what is that actually that I would like to actually share is that one of the interventions which we are actually handling presently, I'll just share it actually very briefly. And it's actually a holistic well-being is affected, and weather-related events in India is actually an ongoing phenomenon, and it keeps happening everywhere. And billions and billions of dollars of money, infrastructure, and a number of people who are actually getting affected. So what is that actually that I'm going to talk about here is that we are actually we have been actually working on different levels of interventions, just not actually the initial stage, and the more into actually psychosocial preparedness aspect for decades actually that here in India trying to put the systems. But the real challenge here is actually that for an 1.46 billion population, we have around 13,500 mental health professionals are there. Still, it is very, very, very inadequate. So what is that actually the strategy, the government of India, the Indian government, the various both government and non-government sectors actually being following is that a very sort of a synergized sort of a thing where actually that the whole system of MHPSS is actually we are trying to re-centralizing it. I'm coming to it, and this is actually the intervention which the presently going on in Wayanad in Kerala. So around 450 people died in this high intensity disasters. I mean, this is actually entire areas being washed out due to actually a very high level of rainfall and all those things. So what actually happened was that immediately the challenge is actually there, how to provide actually the MHPSs. Of course, actually, like Ananda was mentioning, in all our countries, immediate actually care and support actually comes. Of course, it comes. Sustaining is actually the issue. But how we are actually sustaining here, actually, that in this place, how the MHPSS being actually taken care post disaster or a rehabilitation phase, even actually after this one. So that is where actually that the real challenge here is that integrating this psychosocial support into various sectors actually that. So like Emma was talking about actually that how we are actually focusing on the carbon green aspects. So absolutely actually that this is being actually not only taken up as a health department perspective, this is being actually taken as actually a multi-sectoral perspective. And we are trying to actually integrate. See, first and foremost, in my country, actually, that this component needs to be integrated into anything related to the disaster management or a disaster risk reduction. So that is exactly actually that we are actually integrating this into a climate weather related disasters as part of actually first and foremost actually the policy, and second is actually programs, third is actually that intervention, and then capacity building policy and all those things actually comes. But still actually that I would say actually that it is actually a very big challenge, because in my country we have certain regions, but this is coming from a southern region of India, which is actually one of the most resource rich states in India. We have adequate number of mental health professionals. In fact, we had more number of mental health professionals are there actually than the need actually there. So there is actually always a disparity actually of care and interventions when we go to the eastern side of India or a northern side of India. So that is actually we are trying to bridge this actually, that how we can actually bridge. So one of the actually the aspect which we are actually looking at it, not only the mental health professionals, it is actually medical health professionals, non-mental health professionals, and the community. So importantly actually that this is actually the decentralization component which we are talking about. Essentially the government of India is focusing on putting a psychosocial grid in India actually to cover the entire population. Still, it's actually a very, very big ambition. But how are we actually doing it? So we are doing it actually in pockets now. What I'm telling is we are doing it in Orissa, which is actually one of the most cyclone-prone states in India, and Kerala. So how we are actually doing it is integrating into, we have actually the local self-government, Panchayat Raj we call it. So that is where actually that we are integrating this component of psychosocial care as part of our overall health plans, overall disaster management plan of that district. Now we are actually getting into the taluk level actually there. So there is actually the process is actually going on, how to integrate this MHS PSS into a small actually like what you call is a county level, what you call it actually a very prefecture level. So this actually MHPSS component, we are actually trying to integrate at different levels for the local self-government people to take it up actually on that. So this is exactly in Kerala. We are actually involving actually the local self-government. Actually, people who are actually handling at the village ward level, we call it. So people with a population of 500 people, 300 people, how to take care of these people in terms of not only disasters, in terms of preparedness, in terms of various other actually times of this one. So that how we can actually enhance their resilience aspect. So this is actually one of the things actually that we are now been working on this for last 1 decade, but now actually that we got the chance actually for because of these disasters. So we are trying to
Dr. Jai, apologies. Could I just ask you maybe to kind of conclude the slides in the last couple of in a minute or so?
Yeah.
Fantastic.
So
Thank you
what
so
is
much.
that actually we are actually looking forward to it. So we have actually put in a very clear-cut mental health policy framework on this aspect, like how we can actually promote adaptive measures through multi-sectoral and intersectoral engagements and building capacities at all levels. Actually, it is not the mental health professionals, and also looking at actually that population-specific interventions, not like one size fits into everyone sort of a thing, and using the existing well-oiled mechanism of our health system as well as other departments resources to actually make it as actually a sort of a MHPS as an integrated component, integrated sort of a component. So with this actually that it's actually going on here, and probably actually that it needs to be actually taken into a broader population, but it's actually India covering that entire population and the entire length and breadth of the country. It is a challenge, but I think actually that we are actually looking forward actually to bring in the best practices from across the world, across the globe, so that how our population actually benefits, vice versa for the other countries also. Thank you very much for this opportunity, and I'd be very happy to actually take some of your questions.
Thank you so much, Dr. Jais, and apologies for interrupting. I think we can now move to our last speaker on the panel on solutions. So Dr. Marika Kroll, over to you.
Thank you so much, Alessandro. My name is Marika Kroll. I work for the WHO European Center on Environment and Health as a technical officer on climate change and health. And as you may be aware, climate change and mental health are two key priorities under the European Programme of Work for the next 5 years. And last year, we have commenced several activities in the field of climate change and mental health in order to facilitate dialogue and knowledge exchange, and also to increase the awareness on the topic and learn about successful interventions in close collaboration with our mental health team. And I would like to just talk briefly about 2 activities. For the last month, we organized a transatlantic dialogue on climate change and mental health together with a Pan-American Health Organization, where we actually had an excellent keynote from Alessandro to set the scene, and where we also had 3 speakers from each region to showcase that actions carried out by governments, the health sector, and community-based organizations. And we are currently working on a summary for policymakers with key messages from the event, which will be distributed later this year. And then in December last year, we also launched a call for case studies, inviting various stakeholder groups from the WHO European region to submit interventions they conducted to address climate change and mental health issues. And we're currently in the process of drafting a technical brief, which will also feature good practice examples and a summary for policymakers, which will be published later this year as a package. And I would just like to briefly really share here some observations, and a lot of the things align with things that have been said by previous speakers here. I mean, we know that mental health and climate change is really a vast field where we have to tackle various climate change impacts, various mental health outcomes from well-being to mental distress and vulnerabilities, requiring interventions from various stakeholder groups. So one thing that was also just echoed by previous speakers is the important role in emergency response, where we saw through our interventions how important it is also to have routine mental health care services that are already working closer collaboration with the communities. So to have community-based approaches in mental health care, which can be scaled up during interventions, as one of our the organizations mentioned, with first responders being trained in psychosocial first aid to open the doors for mental health professionals in order, for example, to work with affected populations to reduce the risk of PTSD and depression and other mental disorders. But it was also mentioned how important it is generally to strengthen the resilience, especially when we talk about climate anxiety, climate emotions among younger people. And we saw from our call a wide range of interventions to increase resilience and agency for climate action and also promote pro-environmental behaviors. And there was earlier that excellent questions like what is so specific about climate change and mental health? And I think the whole idea of using also climate action to channel climate emotions, creating agencies is also a very important aspect that needs to be understood in order to effectively address this challenge. So we had interventions, for example, from civil society-based organizations where mental health organizations, climate groups, youth groups are working together in order to strengthen the resilience of certain populations. But we also saw a lot of activities from academic institutions where we saw collaboration across various disciplines from education, literature, environmental sciences, and health sciences, which are very interesting. Then there are, of course, also healthcare professional groups who are very active in this space. And again, they also sometimes use climate action as a way to increase the agency among healthcare professionals to cope, to develop their own coping strategies, to deal with the increasing pressure, mental health pressure that's caused by climate change. But then there's also the role of mental health care providers beyond emergency services in routine mental health care, especially also in the case of health prevention. For example, we had one intervention which is trying to establish climate change as a topic in child health through a family perspective to increase family resilience in times where parents are very worried about the health of their children due to climate change. And then there are, of course, also therapy-focused interventions, which test the combination of different clinical approaches, for example, cognitive behavior therapy, to build adaptive coping mechanisms, eye movement desensitization, reprocessing for trauma care, and combining this with other nature-based and community-based interventions, such as community gardening, which I guess is also, again, a little bit more specific to mental health and climate change. And the last point to mention is also what we also saw is a really important role of the academic sector, not only to feature their own project, but also to support other initiatives with monitoring and evaluation, to really have an effectiveness evaluation to see what kind of interventions are working in the field and which intervention could be scaled and are transferable to other settings. So overall, there are really many entry points to address climate-related mental health issues, and we hope to contribute with our work to systematically showcasing how interventions at various levels could look like and which gaps needs to be addressed. And with that, I would like to hand back to Alessandro and would like to thank you so much for giving us the space today to briefly report on what we're doing here in the region.
Wonderful. Thank you so much, Maraik, and thanks Mita and Jaya as well for really outlining, I guess, a range of possible solutions to make mental health systems more resilient in the face of climate change based on your different country experiences. I think we have time for maybe one or two questions. I noted down from Pakistan that mentions how Pakistan has a similar context to Bangladesh and India. It is definitely difficult to allocate resources, which we saw in the devastating 2022 floods here. I agree that we need to integrate solutions across sectors. What are your thoughts on how countries responsible for greater climate change impact could do to support more climate-affected communities when it comes to creating net zero mental health systems? I wonder whether this maybe is a question for either Mita or Dr. Jai. I don't know if you have any thoughts on this.
Mita, you want to answer first, and then I can actually come. Yeah.
Okay, so I think country has the responsibility because they are the main duty bearer. So in terms of ensuring services and other resources. So that's my thought, that we need to work with government, and also we need to include the voice of people with lived experience or the affected people to advocate for it and to work with government. And also at the same time, we can see that what are the local resources available in the meantime, because the time, bigger chance it will take time. So that's all from my side.
Thanks, Meeta.
Yes, let me answer this, because many of the other countries also very similar context to ours. See, one thing is, I was talking about this integrating. Integrating may be actually a very nice word to, pronounce. But this integrating, when it comes to health, is actually the biggest challenge in any public health domain. And especially mental health coming, having this label, stigma, and everything, it is actually all the more, it's more challenging. So what is that actually that we can do about it? See, let us not look this as actually a health related domain, rather than actually it's for an entire population, it's for an entire community, it's for entire society. So that is where actually that we need to look into bringing in the concept of, like, how we are actually looking at this holistic well-being concept, actually. That, so the more the climate related impact, the ill-being is actually, that's, everyone knows it. But how to make others actually be partners into it. So that is where actually that it starts from the community, like I was talking about the local self-government, local self groups. So this is where actually that the importantly that they are the main stakeholders who experience it, who can handle it, who can prepare it. So that is where actually that the human resources are already available. They are readily available in the community. So whether we are actually looking at the capacity building or pooling in resources from whether internally, externally, how we are going to do it, that actually has to be left to the country's strengths and other things. So here actually that one of the aspect actually that which the previous speakers, I think from I forgot the name, she was talking about the digital aspects. So how we leveraged here is actually that post-COVID, because COVID actually brought in mental health into forefront. So in India, we are actually having a 1.25 billion mobile phones. In that, 750 million are smartphones. So what we have done is that one of the way actually to reach out to these people is actually physically it is not possible to cover this entire population. So we started actually a digital initiative, Telemanas, in 20 Indian languages, actually, which is actually in almost every state. It is reaching out actually as a distress sort of a thing, which is responding to not only to the disasters and emergencies, climate related aspects. For example, the elderly, which we started this for the government of India. The elderly who has a number of issues, distress, apprehensions, fear, and various other things, even actually that relapses. So how we can actually prevent this or mitigate these things? So this is actually a helpline actually that at least actually can provide some sort of a thing. So how we can actually leverage, whether it is a digital or an AI. So these things actually can be actually looked into it. Multiple resources actually need to be looked into it.
Fantastic.
Including the corporates. Corporate plays a very major role. So at the end of the day, the money is actually the important aspect. And all our countries actually that the finances are allocated to the mental health is very minuscule when compared to the other actually aspect. So somewhere actually macro to micro level, we need to actually integrate.
Thanks. Thank you so much, Dr. Jai, and thank you again, everyone. So we're now nearing the end of our webinar, and I'm really delighted to be introducing Dr. Van Ommeren, head of the Mental Health Unit at the World Health Organization headquarters in Geneva, who will be providing some closing remarks. So Mark, over to you.
I'm now going to put you to sleep by reading very slowly the closing remarks. No, I will not do that. I just thanks Ale for organizing this event and having it quite dynamic. So that's also why I won't be reading. It's great to see lots of colleagues and friends in the webinar or listening to the webinar, and from all the new times is really good. I think I don't need to elaborate about the interaction now between climate change and mental health, which is quite should be very obvious and very strong. Let me highlight a few points. Of course, in WHO for many years, we have promoted the concept of building back better. It became very popular in the time of the COVID as a political concept. But before that, it's a concept we have been driving for many years. And I would say for my own, my personal professional experience, that much of the support I've had on my job was by linking in crisis to development. That's really, and that's theme here also. So building back better, really important. I'm so happy that my colleagues here at WHO, working with us, working with in our unit, have developed the concept of building better before preparation, and made it really active through simulation workshops, really building meaningful capacity building of people so that we are better, that people trained all over the world are better prepared. We just had a big simulation in Ethiopia, people from 24 countries. It's fantastic. Anybody here, please contact Brandon Gray on the call, who can tell you more about that. And I mean, public health, climate change, mental health, public mental health, they're all, if you like it or not, political topics. And what we see is over many years is more political will for mental health. Definitely, we've seen a lot of political will for climate change. Both not enough, not enough action. Still, too often more talk than action. But there's also action, and some of it has been described here. I will say how important both topics are. Think about it, the major foundation like the Wellcome Trust. It has 4 priority areas: general science, discovery, infectious disease, and then climate change and mental health. So it's that already shows that these are 2 huge topics, and it's in the interaction that we're discussing today. And I think there's opportunities there. And opportunity is very much, in fact, I mean, we are back to the politics. We are in a world that is a little different than a year ago in terms of political realignment, development funding going down. And so we need to be even smarter. People say sometimes we have less now, and we need to be honest that we're going to do less with less. Well, I think we should not do less with less. I think we should do more with less, without meaning that we are going to work more hours a week, but we should work smarter. And I think in this interaction there is things to be done, and I like the focus of this webinar very much because it's focused on the key issues of emergencies, systems, but also greening our response. And I think all of that is just that's where the priorities should hit. It's perfect. We in WHO have been highlighting in recent years 3 levels of transformation is needed in mental health worldwide. One is deepening the commitment and value to mental health. That's one of the 3 transformations, not just a preface or a little side comments. It is that we need much more commitment for mental health and much more value given to mental health. And it includes attention to the climate crisis and action and in its interaction with mental health. The secondly is reshaping environments that influence mental health. Well, from the micro, which is maybe the atmosphere at your home or at work, to the macro, which is the global climate. And that's why I appreciate it, and I know that's really important in the UK, the focus of greening the NHS. But that's actually in humanitarian action, there's also a huge focus on greening humanitarian action, not by agencies like OCHA. What we don't hear too much yet is in the mental health response in emergencies about greening the response. So that's something that could be explored further. Then, of course, the third big transformation is need for transformation in services. If services are centralized, they're not in the community, unlikely because we don't have the resources. They should be decentralized. They should be available at communities. And when they really reach the community level, there is an opportunity, and they should help strengthen bottom-up approaches. So the top-down and bottom-up need to meet. And where do they meet? In the community. And the bottom-up is going to be really important for resilience strengthening of many people. The health and social care system will never, in most countries, reach most people. That's well, I want to, but that's not where we are, and we won't likely be there very soon. But from bottom up, we can reach many people and support. At the policy level, we need to integrate mental health into climate policies and vice versa, including into national adaptation plans and disaster reduction strategies. At the health system level, we need to talk about climate resilient mental health services. Well, I think it's a bit of jargon, but I think in reality that means that services need to meet the ground. There need to be community supports. Overall, we have a policy brief, a few years old. If we need to update it, you should tell us. Not for changing one sentence, but if it needs a major update, you should tell us. Again, Brandon Gray is with us here and is our lead. And overall, again, very timely to have this webinar during this time of great alignment, where we really need to make sure that we do, I believe, more with less. Thank you.
Thank you so much, Mark, for your closing remark. And I think for reminding us of how climate change can, I guess, also represent a possible opportunity for strengthening mental health systems globally. This has been a really fantastic session, which I hope has helped us understand the unique vulnerabilities that mental health systems face due to climate change, while also highlighting the range of existing solutions to make mental health systems more resilient and sustainable. I think if somebody had told me when I started working in the climate change and mental health space that we would one day have a meeting on mental health systems and climate change with more than 100 people attending, I would have not believed them. So thank you so much, everyone, for making this possible. And I would like to thank once more our speakers for bringing this topic to life, and the ATACH Secretary for spotlighting this important but often overlooked issue. As mentioned at the beginning of the webinar, this webinar has been recorded, and the recording will be shared with you by the ATACH Secretariat in due course. And additionally, we will be sharing a summary output of the webinar. Again, thank you so much, everyone, for attending this webinar, and I really look forward to continuing collaborating together towards a future where mental health systems everywhere are resilient and sustainable. Thank you.